Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is Radiation Oncologist Dr. Perez-Tamayo. At Central Care, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, perhaps a second opinion, access to clinical trials and novel treatments, financial counseling, or other supportive services for yourself or your family, Central Care Cancer Center is here for you. At any time, feel free to email with any questions or comments. The email address is askdoctor@cccancer.com. That's askdoctor@cccancer.com. Well, doctor, it's the start of warmer temperatures, which means that people will want to spend some more time outdoors, maybe gardening, going to the lake, hiking, swimming, thus exposing their skin to that Kansas hot sun. So May is National Skin Cancer Awareness Month. Our discussion today will center on skin cancer.
This is a very pertinent topic at this time of the year, and I think it's one that we can actually prevent for ourselves and for our children, because it is an accumulative situation when it comes to sun exposure.
So is skin cancer the most common type of cancer that you would see?
It is the most common type of cancer, and for the most part, it is easily treated with most minor either surgical excision or cream, but it can be deadly and it can kill you. And it's divided into two main categories: the melanomas and the non-melanomas cancers.
So the non-melanomas cancers would include what type of skin cancers?
For the garden variety skin cancer is a basal cell carcinoma, and the word says it all, basal, starting from the basal layer. And it is a very distinct look to it. It has a pearly border. And a pearly border, imagine if you look at it close, put on your glasses if you need to, and you will see that it has a little bit of a shiny border, much like cartilage. To me, it looks like cartilage, and it's in a ring usually. And it could be very small. It could be just a couple of cells in a bunched up little border in a ring, or it could be larger. And this is the most common cancer due to sun exposure, although there are syndromes where people have this throughout their body. And in fact, most of the time, 99.9% of the time, it does not travel. But if you have the syndrome, it can travel in your blood. For the most part, this cancer, when taken off early, it is highly curable without a problem. But remember, was this in your face or in your arm or wherever it started? It's because it was exposed to the sun. So every part of that part of your body, or any part of your body that was exposed to the sun, can also have the same amount of exposure that causes cancer. It's very much like that saying that the straw that breaks the camel's back, or the one more drop that basically makes the water go running down the glass. One more sun exposure is going to turn a cell somewhere in your body to cancer.
That's just amazing when you say it like that, and scary, honestly. You think about if you're just out in the sun, you just happen to get a little maybe sunburn or something. Just that hour, just that, half hour could cause some sort of mostly basal cell cancer.
Well,
right?
when you're in that almost full category, in that one place, let's say that your nose is very prominent, or for some reason your eyelids are exposed to the sun because you're a driver, let's say you're a truck driver, and it may be the side of your face exposed to the sun because you're going in the direction where the sun is at the highest level and on the western part. Well, that part of your body, of course, has gotten more sun than the other part that's inside the cab and inside the truck, and therefore not as prominent. So now you go to the lake to go do some fishing, and you wear a hat, but there's just one part of you that is not completely covered or have sunscreen, and you're going to have this area being exposed to the sun, and it's going to turn to cancer.
Does it grow slowly then? I assume it does, like over time.
Yes, actually, it unless you have a genetic conditions where there's easily a breakage of the chromosome in your skin. It's a mutation that does not allow for what we call electromagnetic forces. You're susceptible to these forces, which is the sun. It's an electromagnetic force, and it causes breakage of the chromosome, and you get cancers of the skin. And we're talking in the pediatric category. This is a different situation, which we're not going to talk about. But for the adult cancer of the skin, a basal cell grows very, very slowly. It's not like you didn't have it one day and then it's huge the next. So it used to be called in the olden days a rodent ulcer, and it's because a rodent just eats something and slowly gets a hole in, those little Mickey Mouse holes that you see in the cartoons. It's not overnight. The rodent works on that little hole until it makes a hole and makes a nest. So likewise, a basal cell takes a long time, and I'm talking sometimes years, to become very prominent. But we've said this before, Leanne, and I want to again emphasize the fact that for every quarter of an inch of cancer, there are 1 million cells, and they grow at an exponential growth. So once you get a quarter of an inch and put it in your computer, and now put it to the second power. What does that mean? How many cells do you have at that point? So every time you let it go, it grows faster, not because it is more aggressive. It's because now you have a whole lot of cells.
What other kind of skin cancer or that's the most common? Basal and then
the squamous cell. Now the squamous cell cancers are a little bit different. They have a greater propensity to spread into the lymph nodes. The lymph nodes are drainage. The drainage that we have really to fight infection, but it can drain cancer into the lymph nodes. Like if you have tonsillitis and you get glands in your neck, these are lymph nodes that are swollen because maybe you have a strep throat. When it comes to cancer, let's say you have a cancer around the ear. This is a common area where squamous cell carcinoma is seen because your ears are exposed. People wear caps and not hats. Wrong thing to do. And so it goes into the preauricular, or before the preauricular means before the ear, lymph nodes around the parotid. And you may have a knot or a node right in front of your ear that is actually full of cancer from the original mother tumor in your ear, on your ear, let's say on the top of your ear. So these squamous cell carcinomas can go into the lymph nodes, and they can also go into the bloodstream and invade your bones and so forth. They are a little more rambunctious, but again, all of these are later stages that you don't even have to go there if you just get them taken care of from the very beginning. They look like scaly. It can be look like a wart, or it can be scaly. Unlike the basal cell, there is no pearly border. It just looks like almost like a seborrheic keratotic area, like seborrhea. But it can bleed easily. It doesn't heal. It grows, and we'll go over some of the evolution of how you can make the difference, so you can see the difference between just a skin lesion because of just age or irritation versus a cancer. So when you are especially redheads, you have genetics that are not in your favor when it comes to your skin. You need to have a complete skin check. And when I talk complete, I mean complete between the toes and the bottom of your feet, and especially in your perineum. I have written papers on this very subject. The cancers like to hide in places that you can't see, like in the men, like, between your anal area and your testicles, in the women, in the labia, or for instance, your hair, inside your hair that you don't see. So your sometimes hairdressers are the ones that refer cancers of the skin to the doctors because they note that there's a little something extra that shouldn't be there. It's a mold that is changing. And so even though your hair, especially if you're someone that has a lot of hair, does protect your scalp, you have parts, or maybe for men, maybe they're not as their hair is receding. Well, you're exposed to the sun, and this is an area where it gets more sun than one should have.
Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo. We've been talking about skin cancers as May is National Skin Cancer Awareness Month. And doctor, as far as risk factors go, I know exposure to sun, even ultraviolet rays, hopefully nobody's using the tanning bed or any kind of a tanning appliance of some sort. But like you mentioned too, the redheads having light-colored skin, but family history, genetics as well, correct?
Absolutely. Family history is very important, especially when it comes to melanomas, and also susceptibility to fragility. There are now these mutations that are being discovered, like for instance, the ATM mutation, which is it's seen more for pancreatic cancer, but it really is a function of instability to fight a magnetic force, electromagnetic force, a radiation force that causes radicals. What are radicals? Radicals are when you divide let's say water into two, water O2, and you divide it, and there's a hydroxyl group that comes into it and becomes a charged particle. The H2O, basically an OH, and the H is divided. That OH is negative. People that know about cars know about batteries, their acidity. And these radicals can produce abnormalities. And so you when you have mutations, you can't fight these. You can't, let's say, buffer them like you would take, some Pepsid for a acid stomach. They don't have the capability. And so what happens is that you then get a cancer because of this irritation that occurs. Now, it's not really an irritation. What occurs is that the hydroxyl group goes into the cell, or the radical goes into the cell and basically disbands their ability to stop replicating. It continues on and on and on instead of stopping when they should stop. So what happens is you get a pileup, like in squamous cell. That's why I'm saying it looks like a wart, because actually what happens is there's a lot of cells being divided in a place where it shouldn't be dividing. So the genetic part is also really something that is being discovered more and more now that we have these ways of tracing our ancestry, and what does that mean as to the beginning of time, the Neanderthals, for instance. I'm sure that we will come to some point, right now we don't have that, where that is going to become a very important part of your susceptibility. You can be extremely fair and be very, very resistant to the sunlight, the forces in your skin, and you can have black skin and be extremely sensitive and actually get a cancer. There are places in your body, especially when they're not exposed to the sun, like for instance the bottom of your feet, or in your nail, let's say between your nail and your thumb, that if you have a cancer there, they act very much more aggressively, or let's say under your axilla. So you need to check everywhere, and you may want to have your partner, your husband, your wife, check in places you cannot see. And then, of course, when you go to see your doctor, whether it's a primary care physician or a dermatologist, make sure that when they do a pelvic exam, they look at this. In fact, I tell women that are susceptible to this to make sure to help themselves to the bikini wax and kind of wax around and make sure that people can see the skin in its full glory. I call it a panoramic view. It's the best.
It's something, a visual that only you can paint.
Well, I appreciate it, because then you can see, and it's an area I have done research on, I have actually published.
Sure.
And so for me, knowing something, getting something early in that region, which is extremely treacherous, it's really quite important.
So you even say, okay, so I can't even imagine having a skin cancer in your nail, or right with your nail, or like a lip. I might think it might be a cold sore or something, right?
Exactly. It looks like a cold sore, but it does not heal. And the lips are divided into the oral cavity, which is something, if you can imagine painting your lips right where we call it the vermilion border, or the border of your lip. If it's in your lip proper, it's more of a head neck cancer, and it's more of a mucosa. In other words, the covering of what is in your mouth. Outside this is more of a skin cancer. And the way that they spread is differently. However, the cosmetic result of surgery in a region like your lip, your nose, your eyelids, your ears, can be very dramatic. especially if it's a large cancer, or if you have a small mouth or you have a small nose. A little divot is going to be a big aesthetic negativity, and therefore there are alternatives. And in fact, in some places, the preferred approach maybe is a combined one, where you may have different modalities, including radiation involved, or it may be just radiation, especially the eyelids, because a functional eyelid is so important to keeping your sight. Why? Because a dry eye will actually kill your eye. So if it is not technically something that can be removed with ease and also giving you a good cosmetic result, radiation is a very good alternative to get rid of it in a permanent way. Now, some people say, well, what's the difference between the radiation from the sun that causes cancer and the radiation that is therapeutic? Well, I said it, therapeutic. What does it mean? It is a killing, or more like surgery, if you can imagine laser, something like this, treatment versus something that makes your cells sick, that is not therapeutic. And a low wave, the waves are very different. And therefore, if you make someone sick, let's say akin to a bacteria that makes you, queasy, this was what a radiation that is not therapeutic would do to the cell, would make it sick and not necessarily kill it.
I had the opportunity to interview one of our patients who had Merkel cell carcinoma on his nose. And so I was really intrigued by that because it's one of the less common type of skin cancers, but it's also quite rare and difficult to treat as well, too.
Merkel cells are very malignant, a malignant process that occurs because somehow when we developed part of our neural crest, which is what forms your brain and your spinal cord, cells are left kind of in different places of the body. It doesn't have to be your skin, it could be elsewhere. And they are in the wrong place. They're not native to the area and they become malignant because the surrounding does not support them. It's, for instance, akin to a testicular cancer given a testicle that does not descend into the testicular area, the scrotum, when you're young. That's why it's important to check your children to make sure the testicles are in place by the time that they're 1 month, 2 months old, because when you have heat in a testicle, it produces cancer. Well, likewise, these Merkel cells are in a place they do not belong, and they become malignant. And they are very difficult to treat because they act very much like a lung cancer, in fact. They start growing into the liver, the lung, and even the brain. So they're treated more radically. It's a multi-modality treatment, and it can be extremely challenging to get rid of them.
So with the basal and the squamous cells, would they just spread to other parts of your body, not necessarily to an organ, correct?
Well, the basal cells, unless you have a basal cell syndrome, no, it only stays there. It's eroding, or it just erodes and erodes. But I have seen basal cells that actually take away half of your head. From years of neglect, you actually see the brain pulsating. You lose an eye for nothing. Usually they don't travel. Squamous cells, however, can travel, especially in the more vulnerable population. And what are those? Vulnerable populations are people that have autoimmune diseases that are not necessarily due to cancer, but others, and especially people that have transplants and they are taking drugs they're actually fighting immunity, so you don't reject your transplanted organ like a kidney, the liver, the heart, the lung. So people that are in this category are more susceptible to having cancers of squamous cells escape and into the bloodstream. And actually, if you are a person that has a challenge like this, you do need to have that, no skin cancer is a good cancer. You can't avoid it. Now, I see a lot of golfers, for instance, a lot of golfers that wear shorts, wear even no socks, or even now the new trend is the sandals. What do you think is happening in those golf courses with the beautiful lawn? We're talking about a lot of weed killers, a lot of organic solvents that are going to go into your skin, and your skin is like your mouth. It absorbs it, and you get a lot of cancers, not only skin cancers, but cancers of your lymphatic system because they're getting into your body. So please do not do that.
Wear the long pants.
Long pants, socks, shoes, and then make sure you wash them. Organic solvents are very much like the like the sap of a poison ivy, it's not that easy to take away because it's sticky and it gets into the clothing and it stays there.
So any spots that are on your skin that are new, that you haven't seen before, changing in size, shape, even color per se, they should definitely be checked out by a doctor.
Yes, the ABCDE rule of thumb, A is asymmetry, is something asymmetrical, meaning it has a border that is not round. It has a little inlet, a border that is irregular, a color that is more there's deeper, like or it's not part of your skin color. It's a different shade, and the diameter, if it's bigger than 1/4 of an inch, it should be taken care of. And even things that you are born with, like many people have nevuses that are juvenile nevuses, that's something that you had when you were born, they can change, especially if they're exposed to the sun into a malignant type. So it's better to have them removed. It's easy. It's really painless. And then it may not be anything, but it won't change into something.
Again, I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center. And of course, we've been talking about skin cancer as May is National Skin Cancer Awareness Month. But doctor, let's get into melanomas.
All right. Well, melanomas, first of all, are usually considered pigmented lesions that have irregular borders. They may have multiple shades, and I always think of the flag, red, white, and blue. You see it. It may have like a lighter darkness in the periphery, and maybe a spot of darkness there. It almost looks like a tarry substance. It's really very uniquely looking. But melanomas can also be white, and they can also be inside. Melanomas don't have to be of the skin, and they're closer affiliated with the Merkel cell that we talked about than actually the skin cancers of basal cell and squamous cell. They're aggressive. It's 1% of all skin cancers, and there's about 10,000 deaths annually just from this cancer, and it's growing in frequency in some countries, like for instance Australia, where there's a lot of Scottish and Irish people that actually went there. It's a higher incidence out there. The outcome is really proportional to the depth of invasion. Now, listen to this. The depth does not mean the size. You can have a pinpoint, but deeply invasive. So size sometimes is superficially invasive, meaning it spreads from your skin laterally, but doesn't necessarily invade in a downward direction. If your lesion is greater than 1 millimeter in depth, this is a concern. And so you have to be, the survival is proportional to the depth of invasion. And sometimes it can fool you. You can think of it as a small lesion, but it is. Now, the age of diagnosis in most of the population here in the States is around 60. Then comes the Hispanic population and the African population. However, you can have a woman that is extremely fair, not have a high risk for melanoma. You can have an African American woman that is at high risk for this. And I think that there's going to be more and more research over what genes are more involved in having you susceptible to melanoma based on your ethnic background. I'm talking about for the generations, not rather than the close several generations back. Now, the biology of the tumor is most of them are what we call superficial spreading, meaning they spread laterally, and 70% of these are that. But it can also be what we call a dysplastic nevus, meaning a pigmented lesion you had let's say as a child, and it turned bad. There's other types. There's a nodular type, and it says that in the description, it looks like a little knot. There's what we call the acral ones, which are more of the ones in the limbs. And there are other ones that are more neurotropic, meaning more like the Merkel cell type of cancers. And all of them behave badly. I mean, they like to go to the lymph nodes. They like to go to the to the blood and spread into other organs. So these are nothing you want to mess around with. There's always surgery involved with these. It can be radical surgery, or it could be more of a wide local excision. Usually the margin needs to be clear to be happy with the result. And sometimes it can't be clear because of the location. Imagine if it's in your eyelid. I mean, how much you may lose your eye just because of the location. So, and they can also happen behind your eyes. So when you have if you are at risk for melanoma, you need to have everything looked at. You need to have your skin looked at, what we call an annual complete skin checkup. Your eyes need to be checked. Your mouth needs to be checked. And your perineum or the crotch region, including between your buttocks, that all needs to be checked because melanomas can hide in these areas.
So what about a mole? Give me what basically the difference is between like mole and skin cancer. I mean, it can turn into skin cancer, correct?
Well, mole can mean many things, but a mole usually is an area that has more pigment. The melanocytes are these cells that, for instance, give color to your hair, give color to other parts, and they are at different shades. Your body really is not one shade, it's many shades. That's why sometimes, especially in the face, when you need a graft, it's so hard to match because it's made out of many, many shades. And people that are in the cosmetic industry know this. If you don't want to look like some sort of a plastic doll, because naturality is, and so when you have these small pigmented, non-malignant pigmented lesions, they're just like freckles, okay? So let's just call it a freckle or a mole. The freckles can come in many sizes, and they can also become in many looks. Sometimes they're raised. Raised doesn't necessarily mean bad. In fact, most cancers are not raised. People, your grandma has all kinds of
moles,
yep. But that's, and it's genetic. Sometimes people come with what we call moly people or moles, and some of them not. But it is the change that is really the important feature. So if you have any moles or any freckles, take a picture of them and make sure that you take a picture with and compare them side to side.
Prevention. Let's talk a little bit about prevention when it comes to any of the cancers and melanomas then. I mean, basically, wear a hat, use your sunscreen, limit your time with sun exposure, or even other kind of outside elements or environmental type elements too, correct?
That is right. But, you know your skin better than anybody else. If you're one of those types that just 5 minutes out there, you start getting red, or you have had several burns in your lifetime. This is a cumulative situation. So if you've had a lot of burns in your lifetime because you liked it or because you worked out in the sun or because you were a sunbather, this catches up with you in later time. So there are sunwear that are specific for sensitive people that have actually your better protection. Certainly sun blockers are very good. But it is avoiding it, number one. Don't go out in the middle of the time of the sun. Go choose the morning or the evening for your strolls. But also, it is your barrier or protective clothing that is going to help you the most. So there are some companies out there that make special clothing for people that are sensitive to the sun that will give you extra protection at the same time, will give you some breathing for the summer. And they have features which people don't think about. For instance, what do you do with your hands? Do you wear gloves? I mean, what do you do? And there are these inserts that these clothing has where you take out a piece of cloth that just basically sits on top of your hand. So you have your hands free, but there is a little shade, much like you would put a little umbrella, let's say, on your hand. And that's important. Now, I always think that the hat is very important. And, the caps are very nice and they're very trendy, but really it doesn't have to be a hat that is stiff. You can wear a cloth hat, let's say like a safari hat that has a screen where you can protect the back of your neck. A bandana, for instance, is very good to protect your décolletage or the front of you or the back of you. And then, of course, the protection from the organic solvents that are in the grasses, which would be shoes and socks and that sort of thing. So barriers are actually your biggest protectors. In fact, you used to see these people with a white nose that had a sunscreen. It's not as seen as much anymore, but they were actually a better protection than what we have. And of course, if you sweat, this takes off your sunscreen. Your sunscreen actually needs to be put on so that you absorb it. So it's not like magic. You put it on and it protects you from the sun immediately. You have to put it on hours and hours before you go out in the sun.
Let's jump into, I wanted to touch base on the ABCD of melanoma. That's something too, because you hear about it, but then let's just kind of go through about what it all means. The A, asymmetry, B, border,
Okay.
C, color.
Yeah, the asymmetry is just what it says, the A part, which is that it's not round, like a wart would be round. It has maybe like an island that has an inlet and a little gulf. It's more like a map. That would be asymmetrical. And especially if the asymmetry is something that it has become, something that has happened to this mole, so that's what we call a change. Or the border, that's the B part. The borders are not round like you would have, again, like a wart, it's round, or like a freckle that's round. But this has more of an edge that is more serpentine, like a serpent. It has an in and out, a wave-like border. This would be an uneven edges. This would be something to consider. The color is not even. It's not like your skin or like a pink, like pinkness. It has different colors inside of it, and it can be, as I said, like the flag, the white, black, and blue, and it represents different things. The black is the beginning of it. The blue can be a tarry looking, where it's necrosis, or actually the death of the cancer starts looking bluish. And the white is atrophy, meaning that your body's actually fighting it. It doesn't like it. It notes it's bad, and that's why this mole no longer is one even color, but it's different colors because your body's actively killing it. Yet it is not sufficient. And anything that is larger than a quarter of an inch should be looked at, not only because it usually is unsightly, but also because it usually is not a benign process.
Can you have all 5 of these for?
Oh, yes. In fact, very much so. Usually people cannot stand things that are big. There are people that can, but you can have, especially the ABC, the asymmetry, border, and color is actually key to diagnosis of a melanoma. You can see it. And sometimes I always give a little talk to different groups, and I show them, and people think, oh, this is a malignant condition, and it isn't. It's just a seborrheic keratosis, and something that looks not very, malignant is a melanoma. It's like those brown recluse spiders and a tarantula. Tarantula is hairy and everything, or one of those wolf spiders, but they're really not going to do you much. But now a brown recluse is going to sting you. And so and everybody has a different way of responding. Some people have a good immune response and can contain the melanoma for quite a while. And some people, as soon as they get it, it goes into the bloodstream.
So not only just check your moles, for any kind of abnormalities, but any kind of a sore that you might find on your skin that could potentially have one of these.
Absolutely. And something that doesn't heal, let's say you scratch it and it heals over, but then it bleeds again. That can be something of concern, and so you need to look into it.
Something else I want to mention to you, and I think I've said this to you before, actually. Slip, slop, slap, slide. So consider, if the ABCDEs weren't enough, here's the 4 S's. Just as a reminder, to slip on a shirt, slop on sunscreen, slap on a hat, slide on some shades, and that's all to help to protect your eyes. Pretty cute, huh?
It is cute, but sad.
I won't mention
With
it
an
again.
S.
And do you have anything else you want to add for skin cancer?
No, it's just I would, one of the things I do want to say is that don't wait. This is what the cancer centers are for. We are trained people, and we can see these lesions and say, look, this is something of concern. Please go and see your primary care or your dermatologist and get it biopsied. Don't wait, because it's an easy thing to do. Just look at it and we can go from there. You have no idea how many times I have diagnosed a melanoma when people are just walking and they know that I'm a doctor and they ask me, is this something I need to worry about? And it turns out to be something that they didn't need to worry about.
Wow. I meant to ask you too, like skin tags. Is that something considered, cancerous at all? No, not at all.
No, but it's a good thing because most skin cancers do not come on a pedicle-like skin tag. So if you have a skin tag, for the most part, they're benign conditions. It can be. I mean, these melanomas and skin cancers can be very close to a normal skin tag or freckle, but most of the time, if there's a stalk to it, it's usually not a malignant condition in the skin.
Okay. Thank you, Dr. Perez-Tamayo. We appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care, all under one roof, so there's no need to travel far for the best in care. Whether you need radiation or chemotherapy, a second opinion, maybe access to clinical trials, financial counseling, or other supportive services for yourself or your family, Central Care is here for you. You have a choice. Bringing that expert care to you is an important component in the success of your outcome. In fact, being surrounded by your family, your friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110 or visit us online at cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.